Now we're going to move to our setting the stage panel, and it's my pleasure to introduce them. These are three people who fortunately have had the experience of working together, so they know each other. I think you'll find their presentation very dynamic and interesting. And I'll introduce each one of them, and then I'll hand it over to them to continue. But our first panelist is Dr. Tricia Lee Roll, and she is a senior advisor at ONC. She's a pharmacist, and through her career, she's been dedicated to improving the healthcare system through the safe use of health information technology. And among other assignments, one that I thought was very interesting was the fact that she served as Director of Pharmacy Affairs for the Academy of Managed Care Pharmacy, where she developed strategies and initiatives to demonstrate the value of managed care pharmacy services and models of care. And Tricia Lee, I'm going to introduce Pooja and Jocelyn also, but then you can take over. And so Pooja, Barbara is an NCPDP board member. She's has a lot of interesting work experiences, but one that stood out to me was the fact that she worked at Dr. First, where she launched the healthcare industry's first certified e-prescribing platform for controlled substances. And most recently, Pooja's work is really relevant because she did the background consulting work with the Institute of Interoperability to establish the foundation and the need for us to have this conference and to move forward in establishing a collaborative effort in the area of e-consent. So I think you'll find Pooja to have a lot of interesting things to say. And finally, Jocelyn Keegan, who is the payer practice lead for Point of Care Partners. And she has over, it's hard to believe, but over 20 years of experience running teams at large, complex international companies, as well as helping to tune up product development processes at smaller companies. And so with that, I will turn it over to you, Tricia Lee, and you all can take it from here.
Thank you, Ed. Thank you, Tim. Thank you so much to our sponsors and organizers of this event. Good morning, good afternoon, good day, good evening, good night, wherever you are joining us around the world. It's so exciting to be here, kind of kicking off an important topic. And I guess the big question is, why is ONC here? Why are we involved? You're going to hear throughout the day, talking about e-consent and how do we actually create the infrastructure to exchange documents for advanced care planning. That technology is really at the heart of that. But first, I want to share some thoughts about how we collectively can advance policies. And so I want to share a bit more about the 21st Century Cures Act that we heard Tim describe, and then kind of wrap up describing how, at the government, we like to be able to look to industry to see where the lessons are pointing, where we have best practices. And I'll share some examples of some communities just like this one that have rallied around use cases, rallied around standards development, and have really helped to strengthen the policies and regulations that ONC puts out, and how that can be a way that we think about advancing this work together. So ONC is the principal federal entity charged with coordination of nationwide efforts to implement the use of the most advanced health information technologies for the purpose of electronic health information exchange. And we do this in a number of ways, namely through the support of standards development. We have a voluntary certification program. And then we also help promote nationwide exchange through a number of coordination efforts. If you just go to the next slide, you can kind of see how those three things all kind of work together. So standards development, certification of electronic health IT modules, products, services, and of course, exchange. How do we get the information actually flowing in usable ways? And we like to coordinate. Office of the National Coordinator is literally in our office's title. So we don't just put forth policies or regulations. We like to work with the private sector, work with other federal entities to think about how do we do this in ways that make sense so that the work that we're doing is actually usable for folks that are on the front line trying to take these solutions live. Thinking about the 21st Century Cures Act, let's go to the next slide. I just want to highlight a few things that are important for our conversation today, and kind of, how do we see a number of issues kind of working together to really help us get robust electronic consent management and exchange for advanced care planning. Tim already mentioned patient access. The 21st Century Cures Act is really groundbreaking in us kind of using standardized APIs for patient and population service exchanges. So enabling healthcare providers to access and exchange information, but enabling patients to get their information and take it from provider to provider to share that around. We are doing that through standardization and certification using, the FHIR Health IT standard. We're going to hear a lot more about this in great detail, I'm sure, later on today. But we also have certification requirements around, the security of documentation, the security of the health information. How do we know that at each level of information of a document that a patient is able to direct and share their preferences on what they want shared and exchanged, what they want to be kept private? We have updated our certification criteria to be more explicit around the security tagging of documentation. This is all based off the data segmentation for privacy standard HL7's been working on. And I'll also mention that we are working around other security measures that kind of make the exchange more secure. Encrypted authentication credentials, multi-factor authentication, so that when healthcare providers and others are exchanging these documents, we know exactly who's getting what on behalf of the patient. I'll also mention our information blocking rule, which is actually pretty cool. I think so. And we understand that in a lot of cases, it's not the technology that stops us from sharing information. Sometimes there are business practices or policies, some of them antiquated, that prevent information from flowing from one setting of care to another. And so the information blocking rule really applies to all electronic health information. There are exemptions for psychotherapy type of information, but this rule really means that healthcare providers, health information networks and health information exchanges, and even health developers of certified technology have an expectation to share information when requested. And we are in a process right now. The OIG will have civil or monetary fines that they can enact when this does not take place. And so we're really kind of stepping back and saying, you know what, how do we make sure that people do the right thing, and how do we help remove those barriers to information exchanging? So that was a really quick survey of some of the things ONC is doing to really set the stage for getting information available and making it flow. But what I really want to touch on before Pooja and Jocelyn jump in is really how we collectively do this. The government has its role, but we really want to look to the private sector for where there are advancements in the use cases that you all are working on. And so a couple examples of where we see and where it's helpful for us to get input from non-government areas is first we have the TEFCA, the Trusted Exchange Framework for the Common Agreement. And basically what it is, it outlines a common set of principles, terms, and conditions that can help information networks and information exchanges develop the trust framework necessary to be able to exchange documents with each other. Every single time that there is a request for information, if you have to stop at that moment and write a new data use agreement, a new MOU, a new specs and scopes, it's not going to work. And so how do we have the infrastructure and at least a framework of trust in place to support that? And of course, the technical requirements around that. So ONC's funding the Sequoia project to serve as our coordinating entity to establish, that common set of principles, the minimum set of terms required, and what that technical framework looks like for large networks to be able to share information easily. And of course, this can apply to advanced care documents and information that needs to be available in quickly at the point of care. I'll also mention the consent to share collaboration between ONC and SAMHSA, that's the Substance Abuse and Mental Health Services Administration. And they, together we developed this consent to share application that would really be a resource for, using FHIR-based approaches to managing consent. This was really successful in our opinion. We began writing it into regulation as a model for others to use. We heard back from the community that we might need to pump the brakes a little bit, that we might want to wait for the consent resource to be a bit more mature, maybe wait for some more real world examples of how this is being used. And, in response to that, we said, sure, we can wait a little longer. We'll watch and observe as this continues along. But, we have our eyes and our ears open to where, the use case matures and when it's ready to be actually written into statute. I know you're going to hear a lot about PASSIO, which is a post-acute care interoperability community, a lot later on. But again, another example of, CMS, another U.S. federal agency working with MITRE, and they're developing FHIR implementation guides on, how to, manage and represent advanced care content such as living wills, on the power of attorney documents, and other end-of-life goals. I'll wrap up by describing the FAST community, which is, it's called the FHIR at Scale Task Force. And pretty much, they are working on an effort to kind of address an ecosystem of issues that, if mitigated, could really accelerate the adoption of some of these health IT standards. And the FAST community, they're being led and coordinated by point of care partners. But, one of the barriers that they are working on is, again, consent management and how that relates to identity, right? And thinking about, when we are exchanging information between different settings of care that might not be well coordinated, how do we really make sure we're sharing information on the right patient? How do we know we have the right individual? So they are tackling issues like identity management, issues like consent management. And again, great examples of how this is work that might be sponsored or funded by the government, but the insights that come from community partnerships are really informing what we're doing from a policy and regulatory perspective. So I'll just kind of pause there and hand over to Pooja and Jocelyn to share more. But I really wanted to kick us off by thinking about, when we think about the government's role, we think about industry's role, it really has to be a two-way street of thinking about where's the best place for government to intervene, but where do we really learn the practical applications and get pointed in the right direction from the work that you all are doing and how it all works together.
Great, thanks Trisha Lee, and thanks for that great overview of ONC and all the work you guys are doing. And Ed mentioned we've all worked together, so it's great to have Trisha Lee back over at ONC, so we have more friends as we kind of work through all this policy and industry partnership. So thanks again. But I think Trisha Lee, really made a good point that, setting policy, when ONC and others in the federal government are looking to set policy, they really do want to kind of have these real world examples, right? And what's happening in real life. And I think that's going to be really important as we move into this new area of e-consent and advanced care planning. So I want to shift gears a little bit and talk specifically about the advanced care planning use case and really how we ended up here today. Ed mentioned that I had done some work around this. I actually, with a colleague of mine, Dr. Michael Solomon, did some work around better understanding advanced care planning and interoperability. Jocelyn, do you want to move to the next slides? And really, the premise behind this work was to, understand, as patients, we may be filling out our advanced care planning documents. It could be a durable power of attorney, could be a DNR, DNI, or it could even be any document that outlines, the patient's wishes. It could be stored in one of the national registries, such as AD Vault or even VINCA, or even uploaded to a state registry. But what happens after that? I mean, how do we make sure that providers are able to access those documents if a patient ends up in the ER and can't speak for themselves? How do we know, how does a provider know that they have permissions and the rights to access those documents? And also, how do we know, is it the most recent document that they're accessing? So as part of this research, we actually talked to a bunch of stakeholders across the advanced care planning space to really understand, what the issues are and what are the challenges with accessing these types of information in these documents electronically. So starting with this first slide, why are we focusing on advanced care planning and e-consent? Well, as we found, and Ed mentioned this in this introduction, especially due to the pandemic, all of a sudden there's a greater focus on advanced care planning activities. Because of the pandemic, you're seeing 40-year-olds ending up in the ER, having to be intubated. You may have someone like me who's in their 50s who did I've done my advanced directive and a do not intubate, but, I didn't expect that to come into play until I was much older. Should I be making different decisions? What if I do end up in the ER due to COVID? So just a lot of focus on this area because of the COVID pandemic. But in addition to that, there's other factors coming into play. One is the aging of the population. When we think about advanced care planning, advanced care documents, a lot of focus is on the older population, the folks with chronic conditions, that kind of end of life planning. And as we see the population get older, we're starting to see, again, more focus in this area, and not just from healthcare providers, but others in the industry as well, financial planners, legal folks, others that are involved in that process. But there's also becoming a greater focus because of quality initiatives. In the past, when we talked about advanced care planning, I think it was often viewed as in a negative light, right? And I think we all remember when patients and the media started using the term death panels, when we talk about these activities. And what we found in our research is that perception's really starting to change in the industry. We spoke to a couple payers who have been paying attention to this for years, especially with their patients with multiple chronic conditions, making sure they are having these conversations with themselves, with their families, about their end of life and end of life care and their wishes. And one thing we found also around kind of this quality initiatives is, as we're seeing this focus shift from fee-for-service to these incentive-based and quality-based outcomes payment structures, I think we are going to start seeing more payers and providers focused in this area. It's really interesting, as literally this morning, just about an hour ago, the New England Journal of Medicine put out an article that talked about this very topic, and it focused on NYU and the fact that they've developed a risk-based system that identifies hospital patients who are at potential risk of dying within the next 2 months. And as the provider's opening up their chart, they're actually getting an alert alerting them of that risk and recommending that they have these conversations with the patient, documenting their wishes, documenting, their end of life care. And so, I think we're just starting to see more and more attention on this, both from payers and providers. So, the focus on advanced care planning and the ability to share documents, to make, these documents interoperable. And again, going back to that 21st Century Cures Act, really kind of focus on patient access and provider access to this information is really important. But, we're also starting to see challenges around this, right? Once you get some focus on it, then the challenges come to light. And let's go to the next slide, Jocelyn. So what are the challenges around advanced care planning and e-consent? Well, we found, in our research, we talked to a lot of stakeholders in this area, and there is a lot of very, very passionate people, when you talk to them around this topic. And I know some of the folks that we spoke with for this research are actually, you're going to be hearing from them later today. But it really goes down to the fact that, I think we've all either know someone or, have heard stories about how they have been impacted because their wishes weren't followed. Ed mentioned he's a retired firefighter, and it goes back to that patient, right, and their caregiver, and making sure that we're documenting that information. And not only that, making sure those documents are available and accessible when they need it. So I just want to spend a minute or two talking about the challenges we uncovered as we started to look at how we improve the process of electronic access and electronic consent around sharing of these documents. So one thing is there's a huge variability between states when it comes down to advanced care planning documents, how they can be stored, who can access the documents, and what's required for a patient to actually legally have one of these documents stored in one of the registries. Some states require witnesses, some require the documents to be uploaded to a state registry, and then others have no rules or restrictions at all around documents. Even when we started to dig into the POLST document, and for those who may not be familiar with that, POLST is essentially a portable medical order, and there's actually a big national effort to standardize this form. But even then, as we talked to folks in different states, the general consensus was, yes, the form is standard, but there was not necessarily standardization around uploading those documents and access to those documents. We also discovered that EHRs are actually storing, they have the ability to store advanced care planning documents. But when we talked to physicians that were on the front lines, we talked to a couple of ER physicians, they shared with us situations where there may be multiple instances of the same document. And in an emergency situation, they just don't have the time to be going through and doing this reconciliation of the documents, making sure that they have, the most accurate, the most up-to-date one. We also uncovered challenges around structured data and structured information. Now, I know, again, we're going to be hearing later in the day around efforts, the PASSIO project that Tricia Lee mentioned, and I know efforts at HL7 where projects have been going on, where we are working on doing, getting to that point where we have some structured data for these documents. But again, the documents vary so widely that it's, kind of figuring out what can we actually store in the EHR, what information would be available in a structured way, and again, how can providers access that information electronically is definitely a challenge when we start talking about this. And then finally, briefly, I touched about this earlier, just the idea of this version control, right? Even when a provider could access the information, how do you reconcile if there's multiple documents? And how does a provider know that they have that permission to actually access the document? So a lot of challenges when it comes to this area. So let's move to the next slide. All right, so I know everyone out there that's used to presenting, I think this slide checks every single box of what you're not supposed to do when presenting slides, but it's really here just to kind of give us a reference more than anything else. I know we're going to be, talking later in the day, kind of all the different efforts, all the things that are going on, and this will be available as we kind of go throughout the day. But, this was really the result of the work that we did, where we outlined a patient journey, of someone going through this advanced care planning process. And it was really eye-opening for me, especially because this was, for one thing, a little bit of a new topic area. But what you realize is it's not just healthcare providers, right, in the process. I mean, starting from when, we've got community outreach people that are actually going out in the community and talking to people about doing their advanced care planning. It could be your financial planners, it could be your lawyers. There's so many kind of different folks involved in that process. And, you know, this slide just really shows kind of that journey of not only starting that process of thinking about this, but also, you know, going through that process of creating the documents. And on this slide, I did highlight where e-consent comes into place, right? There's the consent of creating the documents, uploading the documents, and then eventually accessing these documents. And Jocelyn, if you want to move to that next slide. You know, once documents are created, then we looked at the journey of, you know, once that patient ends up in the ER, what happens from there? How does a provider access a document? You know, once they get out of the ER, you know, or first they're admitted to, you know, a floor, then they go to a step-down unit, then they're released to home, and then how do you keep those documents up to date? So again, just wanted to share this more as kind of, you know, what is that patient journey, and kind of keep this in mind as a framework as we go throughout the day. Let's go to the next slide. So, you know, just finally to kind of wrap up my section, you know, as we started to think about this in terms of what do we need to be thinking about in terms of interoperability, what do we need to be thinking about in terms of patient access, you know, provider access, e-consent, you know, what we realize is it's really goes beyond just kind of the standards development. And I know we're going to be talking a lot about kind of standards development today, but when you think about advanced care planning, it's really a broader process than just, you know, having a document to access. There's a whole kind of workflow process around this. And as we started to think about kind of what needs to be improved around this, it was all the way from that very beginning of kind of, you know, getting someone to even care about this process. And again, you know, someone who's in their 40s and 50s probably wasn't even thinking about this until the pandemic hit. And then all of a sudden we're like, oh, wow, you know, this is something that even, you know, folks in, you know, who may be healthy need to start thinking about it. You know, how do we get people engaged? How do we get those documents completed? How do we think about the funding around all of this? You know, what are payers? What are providers thinking about? But then, of course, you know, the standardization piece, right? Do we start with saying, what is that kind of common vocabulary? What are those common data elements that at least we can start to, you know, document those in order for it to be easier for providers to access. So this again goes against all the PowerPoint rules, but I wanted to put this framework out there. You know, it's really around not just standards development, it's really this whole process. And again, throughout the day, keep that in mind. You know, we've got a lot of different stakeholders in a lot of different areas, as Ed mentioned, and everyone's going to have a role to play as we think about how we advance this going forward. So with that, I'm actually going to turn it over to Jocelyn to talk a little bit more about kind of these multi-stakeholder collaboratives.
Great. Pooja, can you hear me okay?
Yep.
Awesome. Okay, so this was a great setup, and again, thrilled to have the band back together with Trisha Lee and Pooja. We hardly get to work together out in public, so fun to be here. We're going to try and preserve some time at the end to take a couple questions. So if you do have questions as we're talking, and we've also are more than happy to talk amongst ourselves in front of you guys when we wrap up. But I think, you know, Trisha Lee did a great job of sort of laying out sort of what the role is for the feds here and how ONC is sort of watching and participating in this process. Pooja shared with you the background of, you know, what the domain is, what the problem is, why we think that this is such an important topic. And I'm here to talk a little bit, I think, from the front lines about how you make this work in reality. And for folks that aren't familiar with Point of Care Partners, we're involved with a number of multi-stakeholder initiatives across the industry. As you heard Trisha Lee mention, we provide support, really, I would say, in the human translation layer of what's coming out of ONC FAST, which is a great example of an accelerator type of project. It's completely in-kind resources. In addition, Pooja has spent some time working on some of the products coming out of the Karen Alliance, which is really about getting information freed for patients and for patient applications. I'm the program manager for DaVinci, which is a program under HL7's accelerator program, which is focused on really this ability to be able to digitize and reduce burden for providers and payers as they work together to move towards value-based care contracts and really just taking waste out of the industry. And in addition, we have a long history. Our founder, Tony Sheath, actually worked very closely with folks in Michigan to roll out e-prescribing under the SEMI project for folks that are familiar with it. And so while we were sort of mid-flight, I would say, in DaVinci probably about a year and a half ago, we started thinking about what is it that's making this work compared to other sort of ideas where people get together and say, how do we get the industry to work together? And we found that there were common elements. And so we actually just published, I think finally, a white paper that talks really about what those pillars are. And we spent some time sort of with our best and brightest in the team to really think about what that is. And I'm gonna share with you sort of what our learnings are. And I think that there's a couple things that I would sort of hone in on and pick up from where Tricia Lee and Pooja were talking today, because I think that when we look at sort of this topic in particular in the middle of this pandemic, and where we started this project really at the outset of the shutdown, this idea that I think we are dealing in sort of unprecedented times, and there hasn't been a better opportunity, I think, to sort of splay open for this particular topic around advanced care planning and this idea of consent to really be shown, I think, of sort of the lack of maturity or opportunity that we have here in the current state, and how do we start to free that information and take advantage of the tools. But there's one thing to say, this is really important, and we can all personally identify with the risks and the challenges. If you've been in a place where you're putting somebody's DNR documentation in their freezer or on the back of their door because that's where the firefighters are going to find it, you understand sort of the importance of the information and the ability for us to make it available to whoever is going to be taking care of you wherever you need help. There's a big step between that, and then how do you gather the right people to actually execute and actually solve the challenge really at an industry basis. And there are, I think, common themes on how you get a high-functioning team that creates goals, deliverables, and can actually execute on the idea of creating artifacts. I mean, I think we've all been part of programs that are really important where you get to have really great conversation, but how do you go from that ability to be able to be brainstorming and coming up with ideas to actually creating artifacts like standards, being able to, sew together all these disparate pieces and parts and actually get them adopted in the industry. So I would pause and say, I get to do amazing work every single day in projects like DaVinci that I get to work on. This particular topic, I think, touches all of us. And so we're going to talk about in the next few slides what the elements are to really make one of these projects work. But I would suffice it to say, and I'm a big analogy heavy person, it is algebra, and it's about getting the right components together. And it's really dependent in some cases on what the current market conditions are, the regulatory conditions, what the level of pain on a particular topic is, and the cost or cost avoidance in some cases to really get the traction that you need to bring together that party of the willing. And then let's talk about sort of once you have that bolus, right, that idea of there's a subset of problems or challenges that we're trying to tackle, what is it that tips you over to actually get you to that high performing team that can actually execute? So the first thing that I think this idea around a strong champion is this idea of you need really strong leadership. And this isn't about the most important person in the room or the person with the biggest title. It's really about the high emotionally intelligent individuals and organizations that can keep people focused and on target. I'll use the word focus a lot to talk about the work that we're doing. The second is you need funding, right? At the end of the day, there needs to be a funding model that's equitable and that people that want to join and be that pointy tip of the spear can get buy-in from their own organizations and can carve out what I would think is even more important, really the in-kind contributions and time to make sure that we can make forward progress on whatever the project is. And the next issue is this idea of stakeholders. It is incredibly important that you have all the right voices at the table. And this becomes important not just for making sure that you get it right, but also making sure that everybody's got skin in the game and will be ready and open to adopt when you're ready to make the business process changes that need to happen out in the market. And so I think that this idea of moving to standards and being focused on real world problems as we talk about getting real world adoption is really, I think, one of the most critical pieces. And you heard Pooja lay that out as she was discussing the challenges and barriers. this idea of being focused on use cases, and I'll go into a little bit more depth on that on the next slide, is critically important in order to make sure that you've got the right traction. But if you don't have all the players, all the people that are affected, not by current state, but the future states that you want to move towards, then you risk not getting it right, or you risk somebody rejecting it, or you sort of don't have the opportunity to take sort of the competitive aspect out of this. And that gets us to the point of standards, right? I think we're at a point in time in the industry that everybody really agrees that there's no value in investing in variability where there doesn't need to be variability, and that the table stakes of point-to-point connections and making data liquid isn't a market differentiator. And I think that that's a huge sea change for the industry over the last couple of years, and some of the technologies that have already been referenced, like HL7 Fire, I think help level that playing field so that we can really focus on sort of what is the content and what are the workflows that we need to look at. When we think about creating these multi-stakeholder groups, this idea around governance and the right oversight, I think sometimes is viewed as sort of overhead or maybe extraneous. This is something that I found in my own personal career over the last 20, 25 years, sort of driving change, sort of making sure that everybody knows what the road rules are, that things are consistent and predictable, and that people understand how the processes for decision-making work, and that they're transparent, and people feel like that they have a stake in the direction of the project and where it's going, and that people have a sort of a level access to make sure that they can make impact to the project, is incredibly important. And I have found that when you don't get this right, people get derailed, they pull away, they don't feel like their say is being heard. And that gets to my last point, which probably seems a little self-serving today, I'm kind of chuckling to myself, is that this doesn't happen by itself, right? So making sure that you put the right bodies, and the way I talk about it when I talk about Da Vinci is, that you're funding just enough resource to make sure that things keep moving forward, and that you keep that focus and you don't get distracted, but also bringing the subject matter experts that can be augmented by the community's in-kind resources is really a recipe for success, because we know that we can all collectively fund something and it will cost us a fraction of funding it on our own or trying to accomplish building standards in a vacuum by ourselves. And when we don't fund it, things often languish. I can give a number of different examples. I won't name names right now, but where things weren't necessarily moving as fast or as quick as they could be. And once you apply sort of that structure and that rigor and just even part-time resources, to create that focus, to get the work done offline in between meetings, it allows the momentum that's necessary in a project. So I'm going to touch on just one important aspect here from a presentation perspective is this concept of the use case. And so this idea that this group that is convening, and we look at the whole topic around advanced care planning, is we really look at sort of what is going to be necessary for this to make progress. And I'll use sort of Da Vinci and some of the other projects as an example here is, people need to know the problem exists, right? That real world problem needs to be acknowledged and shared. When you're going to create multi-stakeholder groups, you're not selling to somebody they have a problem. They have to willingly come to the group because they acknowledge that the problem exists, and then it can be solved by standards. We've talked about sort of supporting that with funding and making sure that you've got the right structure in place. But at the end of the day, and I didn't flip my own slide, sorry about that. At the end of the day, this ability to be focused on, understanding what current state is, what end state should be, and what roles and actors are involved, who are the people that are actually putting hands on keyboards or talking to patients or caring for patients, understanding what they interact with and how they interact with it, and what data is available at a given point in time, and what underlying technology exists and can be picked up and used to get to all the different endpoints that you need to get to. That all encapsulates the concept of a use case, and that being able to do your work in this way really allows you to keep that laser focus about how do I start to get something out that minimally is going to improve things. And I think when we think about this and we think about all the technology changes that are happening in the industry, I think for a topic like this, it's so incredibly important to understand what's available to help from a technology perspective, but also how do we refactor and look at the business process challenges that need to happen, and who are the different organizations that need to be involved that are providing these decision-making tools for patients today? And how do we incrementally make this better in the industry by supporting it with changing business processes and the technology that can support it? I think that having the ability to convene and making sure that you have the right stakeholders in place, like we have done in Da Vinci, lets you drive forward incremental progress and get people to gradually adopt. Just in closing, before we move to take a couple questions, I think that at a whole, this ability to bring the right subject matter experts with the right stakeholders and the right organization, tie that together with processes that are standardized, that people understand how you're going to work, apply this ability to be able to create content, create the right specifications, create the right tools for people to implement, is how you're able to get to success and create, I would say, the necessary momentum and positive peer pressure in the industry to get people to come and present. When we think about multi-stakeholders working and the reason like projects like Da Vinci are working, this focus on the use case, this focus on sort of consistent process and methodology has allowed us to be able to make the progress over, you know, a 2 or 3 year short period in the industry, to have multiple implementation guides that folks in your community are picking up and using. And I think as we sort of pivot to sort of back to the ACP topic, you know, I would probably pivot over to Pooja and then Trisha Lee to talk about, you know, when we look at this, you know, why is this the time, and why are we ready as an industry to tackle ACP and e-consent as a topic?
Great, thanks, Jocelyn. So yeah, I think we've got just a few minutes for questions. I know we've had a couple questions come in, but just to kind of address that, I think, you know, I think it really comes down to the fact that, you know, based on kind of the market research that we've done, you know, all this focus on kind of interoperability, you know, we have kind of some very specific use cases that we've been looking at, and, you know, kind of focus from ONC, from CMS, and I think this is one of the use cases that's a little more peripheral, that we need to actually start getting some traction around. I mean, you think about how Da Vinci started, right? And that was what, 3 years ago now, maybe 4, where, you know, at HL7 meeting, you know, there were payers in the room that were like, well, how are we going to support use cases for, you know, sharing of information for value-based care? And so, you know, that was 3-4 years prior, where we were just starting to get people to think about it. And to me, I think with advanced care planning, you know, we're in that same situation, right? The pandemic got some focus on it, the aging population, all of the factors we talked about. Now is the time for kind of all you know, kind of the group to get together to say, what are the use cases? What do we need to be focused on? So I think that's, you know, something from my perspective.
Let me unmute myself. I'll just add to that and just say that, you know, there's a common thread that is going, that you can observe through a current HHS regulation at this point. If you look at ONC, you look at what's happening at CMS, the common thread is patient access to information. We're really focusing and honing on how do patients get the right and access to their information. And obviously a use case like advanced care planning is so key and critical to that. And so this is the time. I think that there are a lot of things lining up in the standard space and regulatory space. And I think this is a good a time as any, especially with the pandemic, to really consider how do we make this workflow good, not just for, you know, all of us who want to exchange this information, but for individuals. You know, I really loved the diagram that Pooja shared about this kind of ecosystem, right? That we're not just thinking about technology, there's also policies, regulations, legislation, especially in this country where we have states that have different laws and requirements, different jurisdictions might have requirements about wet signatures or how things happen. But if we think about that, the workflow isn't just happening in doctors' offices. I mean, you might have some of this taking place in the lawyer's office. You know, they don't have an EHR, you know, they might be just signing documents on paper. And so where we can intervene to make it all work best for individuals is what makes sense. And that's why we need the whole community. Because, you know, at HHS, you know, we only have a particular vantage point. then every one of us are going to look at it from a different perspective. But if we all kind of bring it all together, we can kind of tie some of those dots in.
Great. So Jocelyn, I think we had a couple questions come in. And I don't, let's see. So
Do you want me to tackle the funding one real quick?
yeah, if you want to do that, and then Trisha Lee, I think there was one for you
Sure.
as well.
So, so when we think about, and the question is, community-based organizations have much of the information that's been discussed. They don't have the ability to fund beyond in kind, and how do community-based organizations get involved in sharing information as we might be a well-kept secret? I think that that's a great point. And I think that as we think about these collaboratives, I think one of the things that's really incredibly important is figuring out what that business model is. What is the funding mechanism for a multi-year initiative to make sure that everybody can come and contribute, and just be honest about the fact that people have different levels of access to capital, right, to bring cash into a situation like this. And then that there are other participants in the industry, I think, that are often willing to fund this kind of work. And so there's a little bit of a matchmaking. I think this is where governance becomes really important. I'll use an example of what we did on Da Vinci. Is we have a large pool of operating committee members that essentially is anyone that funds the project above a certain level gets a role to be able to make decisions. And then we have a representative steering committee. So folks that maybe don't bring as many funds into the project still have stakeholders at that highest level of the decision making in the project. So it sort of levels out sort of who can bring in-kind contributions. And it also allows those folks funding at a higher level to actually bring in partners from the community. So in Da Vinci's case, our payers are able to bring in provider organizations as sponsored members to the project. And I would propose that a similar model would probably make sense. But I think that that's part of the hard work that everyone has ahead of them to figure out what is going to make sense for this space. And I think Pooja's point around the fact that there are many community members involved here that aren't your typical covered entities, I think is something that really needs to be taken into consideration, and what tools and applications are really going to make it easy to make them connected in a way that existing covered entities are.
Yeah, Jocelyn, yeah, go ahead, Trisha.
I was just trying to hit the next question. There was a related question. You kind of answered this already, Jocelyn, about, who in the C-suite is the most likely champion. Jocelyn, you answered that question already. I would just add to it that, when you have a champion that is able to direct the work to take place, that's always great. So you want to have the focus, but you want to have an individual that can sign off on things, fund things if necessary, get everyone else in the organization excited about doing the things. That's critical. There's a question for ONC, do we recognize some sets of the advanced care planning activities? I'll just read off a list of some of the things that we kind of have our eye on monitoring. We are thinking about this kind of holistically. What are the actual care preferences that patients might have? Where does the durable medical power of attorney fit in? Living wills, personal advanced care plans, and we think about quality of life priorities. I know I don't have much time to share about that, but we're thinking about kind of the whole gamut of, I have individual preferences about my care in general, how I want my care to take place, in addition to the actual legal documents, how they're defined as well. So I hope that answers that question.
Great. And I think, Ed, it looks like we are out of time. So thank you all for joining us today. And I'm really excited to kind of be part of the rest of the conversation of the day. So thanks again, everyone.
Well, thank you three for presenting today. I mean, what a great set of experience you all have. And the fact that you know each other and we're able to go back and forth was, I think, very valuable. And Pooja's work in doing the foundation for e-consent and ACP in this session today was great. Trisha Lee, and you're representing the government perspective from ONC. We all look up to ONC for a lot of leadership and direction, of course. And Jocelyn, your work with putting together these collaborative type organizations, I think, is especially valuable. And it's going to be a theme as we go forward today for us all to think about how we can work together and form a community of practice to be able to work on advancing and smoothing the workflow for advanced directives and e-consent. So thank you all very much. And